do is we help people in the community. So a lot of people obviously have cancer treatment in hospital, and afterwards they sometimes need a lot of support close to home, and they don't always want to go back into hospital for support. So what we have is a number of community cancer centres in and around the region, and people can come for counselling, support, therapies like massage and Reiki, and they can also come along and do courses on how to move on. So if they survive their cancer and are ready to move forward with their lives, we help them do that as well. We do grants for patients. So for example, if you need to adapt your home or you're struggling to get to and from hospital, maybe need accommodation, then we can help with that. We also have holiday homes. So a lot of people like to get away with their family, and sometimes that's their last holiday together, so they can go to one of our holiday homes. And finally, the other thing we do is transport. So some people struggle to get in and out of hospital, particularly from the Isle of Wight, who sometimes have to come to Southampton for treatment, and we have buses and help with transport.
The centres are manned by a centre manager and a trained group of volunteer befrienders, and the idea is that you can come into our centres at any time, come in for a chat, a hot drink, and just chat to our volunteers. The volunteer befrienders that come to our centres are exactly what they say, they're volunteers. They're usually people who have either been impacted by cancer themselves or want to do something in their spare time. They're all trained, and they all go on a training course, an in-house training course, to help them deal with the sorts of things that they might be listening to. A diagnosis of cancer is probably one of the most traumatic things that anyone can go through in their lives, and the impact of that diagnosis can be quite staggering. We hope to be there to help more people, whatever their diagnosis is, whatever their age, whatever the stage of their cancer. We aim to be there to help people when they need it, for as long or as little as they might need that help.